Welcome, ladies and gentlemen, to this week's episode of the Essential Therapies Podcast with Dr. Cindy. Today, Dr. Cindy has an interview with Janet and her experiences with myofascial release, the homeopathic journey that she went on, the importance of trust. They talk about MFR and Channel 3 and Channel 5. And Janet just has an amazing story that I really think is going to resonate with a lot of our listeners, just about how she got to where she is today in comparison to where she was. So we hope you enjoy today's episode, and we'll see you again next week.
Hello, and thank you for joining the Essential Therapies Podcast, where we are trying to teach as much as we can about different therapies that will help your body, mind, and spirit. So I'm Dr. Cindy Hodgson. I'm a physical therapist and exercise physiologist. And one of the primary things that I like to educate about and has been probably the most essential therapy for me in my life, and the focus of this podcast primarily is fascia and the connective tissue in our bodies, and using the John Barnes myofascial release technique in helping to free our fascia, if you will, and promote movement and function and feeling good. And one of the challenges that we have is coming up with outcome-based studies. And a number of years ago, there became quite a push to really focus on that. And it's quite hard to come up with, everyone is so unique. So what I've decided to do in these recent podcasts and moving forward is to talk to people who've had experiences with myofascial release and get patient testimonials, kind of like, life case studies, if you will, and just hear from people themselves. And not long ago, I came across a interesting and wonderful woman that I'm going to introduce you to today. And actually, Janet Seitlin is her name. I have never met her in person. We've only met virtually, and it's been great meeting you, Janet. Janet is an attorney and an adjunct professor at Miami University in Florida. She has always lived in Miami, I heard. And I think, Janet, what kind of brought us together was the John Barnes myofascial, it's the MFR Insight Facebook page, which is a private page for therapists and patients. And I saw you posting a lot of great things. And then you kind of saw me doing my cold plunges, which was interesting. And then that's how we got chatting. Is that correct?
That's it. You have to
So
understand,
what else can you tell us
in
about
Miami, you don't go swimming until the water is 70 and it's 80 outside. I mean, if you don't touch the water until it's the perfect combination of water and air temperature. So to watch you plunge into that water at
Right.
30 degrees or 20 degrees just amazes me.
Yeah, it was fun. Yeah. So, here I had been kind of following you and some of the great posts that you were putting up, and knowing that you were a patient, and just seeing, really being curious about your journey before we even interacted. And then I'll never forget, you sent me a little video saying that you were going to do your cold plunging in 76 degrees water, which was a cold plunge for you. And hey, if it makes you, flinch, it's cold for you.
No, you have to understand. If it's that
So
cold, I'm
anyway,
out of
thank
the
you.
water. I have to
Yeah.
acknowledge I've done something like that cold plunge, but it was after a sauna, and the sauna was the main thing. You did the sauna, you run out and you get in the ice water
Yeah.
and you run back in. That I could handle, but
Right.
that's about
Yes.
it.
Contrast therapy. That's great too. So anyway, I'm so glad that you reached out that
Sure.
day. And then I did hear you talk on another Zoom call, I believe it was about biotensegrity, and talking about the John Barnes myofascial release approach, and it just intrigued me even further. And that was when I finally reached out to you. So what I would like to ask is for you to tell us some history about your injuries and your diagnoses that you've had over the years, and especially interested in what was recommended to you by your physicians and surgeons as far as, surgeries, or how they were wanting to treat your particular conditions, and how how you decided to behave in that light.
Well, as you know,
And, that ultimately led you. Yeah.
it's a pretty long story, and it literally starts when I was 3 years old, if not younger. And I have speculated I might have had birth injuries, but beyond that, I know for sure that I injured my foot. And most of my injuries were on my right leg or right foot. And when I was a child, I was riding on the back of a tricycle, on the little platform, and my little foot must have gotten caught in between the platform and the ground. And and at the time, obviously I don't remember what my mother did, but my guess is she took me to the doctor. Though at that time, the doctors came to your house, and they probably put cold things on it and warm things, and gave me an aspirin and told me to keep going. But at 3 years old, when I broke it, they didn't really understand anything, and they after the actual incident, for 6 months I kept taking my shoes off on the one foot. And my mother couldn't figure it out. And they finally went back and they took an x-ray, and they discovered I had a Lis Frank fracture on the top of my foot, which affects your ability to walk and to bear weight and all of those things. And then fast forward to fourth grade, and I was a very active child, loved running and jumping and climbing and doing all of those things. And I was at home, and we had our home, we had a wooden floor that was where our bedroom area was, and there was a throw rug on top of it, and there was a hallway that led from my bedroom towards the living room, and there was also a wrought iron fence there. And I was running full speed. The carpet slid, and I hit my right knee into the yeah. I mean, it's hard for me to even talk about it, but and at that point, I didn't break anything again. And this was I never had these solid breaks where everybody could say, "Oh yeah, you broke your arm." I did something to my knee, and I was limping around. And I remember, trying to climb stairs to go to. I was in fourth grade at the time, and and that was it. But like every child, you kind of live with it, and then you recover. And whatever treatment I got was the chiropractic of the era, and I don't even remember seeing a chiropractor much. Whatever they gave me was, as I said, it was ice and the palliative things. um, what else? So now I had I had foot and knee. And then again, when I was in college, when I was in my late teens, I guess early 20s, I sat straight up in bed, did a great number, and pulled my sternocleidomastoid muscle. um, that was the only thing I ever learned about the muscles. And that was kind of very. And I also,
That's a
yeah,
good
that
one
was
to
it.
learn.
My dad was a dentist. I grew up basically in a medical family. My dad was a dentist. His brother was a dentist. All of their friends were doctors or surgeons or anesthesiologists. And the answer always was go to see the doctor for everything. It didn't matter if it was a hangnail, or anything else. It was just go see the doctor and let the doctor tell you. And the doctor was always the final authority and always kind of the god of it. And that was how I was raised. That was the atmosphere I was in. So I had those three injuries, but I was managing to live my life, and they never really bothered me. And then I was in law school again, now another 15, 20 years later. Well, no, it wasn't quite that long. Maybe 10 years later. And I went roller skating. And I had never used the boot shoes before, and I didn't know what that little thing on the front of the underneath the tip of your toes was. And at the time, I think it was dark.
Stop.
Yeah, I figured that part out real quickly. But at the time, I didn't know what it was. And I remember, in my head, I was thinking at the time, I think it was Dorothy Hamill was the great ice skating thing. And in my head, I was going to make one of those turns, and I stepped onto that stopper. And instead of doing this beautiful turn, my whole leg just suddenly jammed stop. And so I re-injured. I had, what is it, a couple of pounds skate on my foot. So I re-injured my foot, and then I re-injured my knee at the same time and jerked down. And that was the injury that really has defined my adult life. And I was probably 30 at the time. And I'm now 74. So it's been a long haul dealing with that. Um,
Wow. So you had some layering there
oh,
still,
tons of
like all, and this was all on the same side.
Right.
And
And then there's the
yeah.
other stuff too. And I think this is important because when you're talking about MFR and you're talking about releasing, you're not just talking about the things you want to let go or the immediate injuries. For me, there was a lot of angst in my growing up, and I'm not going to go into it, but I mean, I didn't know that your stomach was supposed to be soft. My abdomen was always like a brick from nerves and from being always driven in some way or another. So it wasn't just the physical injuries. I was, whatever my emotional stuff was going on was also restricting me. And again, I only figured this out now, but that's what was going on for me is, you're living a life, you're trying to deal with whatever the challenges are in your own life, and we each have different ones, but they're still important and they're big for us, whether or not, it doesn't matter what your challenge is, you still have to deal with it. And so I and I often felt very isolated and alone for different reasons. I was a lonely, I had sisters. I have a big family, not a big, my immediate family's not big, but lots of relatives. And it was a beautiful, and Miami was a terrific place to grow up. Ask anybody who grew up in the 50s and the 60s here in the 70s. It's a terrific place. So, but there were the other pressures, just that you get from life. So all of that was going on, and I was also, and it took me a long time to understand that I was gay, and that also it was a secret. And when you have secrets, you're not talking about them, you're trying to avoid doing things with your life, or how do you introduce this to people who don't understand. And so there was that extra level of pressure going on too. So there's all this stuff plus the physical injuries. So the physical, I tried every kind of, I did chiropractic, and I had some terrific practitioners. I had a chiropractor who was he did herbs, and he did acupuncture and acupressure, and he was very into dietary things, and homeopathic medicine. So, and for a very long time he was the one who helped me work. I did foot reflexology, which was fabulous. And I did I mean, what is it? Acupuncture with the needles, which did nothing for me. And I've done, like, I did every kind of modality you can imagine to try and deal with it. And for me, one of the things that came up was the idea of surgery. And for me, I mean, I have my natural aversion to it, but always early on when I first injured my foot, it was, we don't know what you did, but we can cut you open and look at it. And that didn't sit right with me, and I was telling you, I mean, it's such a long journey, I don't know really how to pull it apart, so I'm just going to keep talking and it'll come out. But so I mean, I saw a surgeon for my foot, and as I was telling you, what settled in for me is the first I saw an orthopedic surgeon. He was the first guy. He was this wonderful grandfatherly kind of guy, and he took lots of notes. And I was in love. I realized I fall in love with my providers, and I'm not sure why that is, but it is. And so I fell in love with him, and but he could never figure out what I had done. And this is after my roller skating injury. And he looked at me, and and this was I mean, I went through every kind of doctor you can imagine during that period of time. And this is also while I'm in my senior year of law school. So it was a lot of pressure. And so what happened was I went to see him. He said, I'm going to do an arthroscopic surgery. And nobody had ever heard of them at that point. He says, and it's not going to be heavy surgery. I'm just going to put a little tube in your leg and look around. And I thought, okay, fine. But I was in so much pain. I basically said, whenever you get in there, just cut it all out. Just get rid of it. I mean, and at that point, I wasn't averse to surgery at all. It was like, just get rid of it was my basic thing. And fortunately, he didn't listen to me. He just looked around. And after it was over, he said, there's really, I thought you had a torn meniscus in your knee, but there's nothing wrong with your knee. But I still had a lot of pain in my foot, and the pain settled behind my, just underneath my ankle. And it was like, when you hit your funny bone, it was that kind of a radiating pain in my ankle. And so it affected me constantly. I walked on that. That was what I was walking on. And so I had a certain limp, but around the same time I did that, I also started practicing yoga. And with yoga, I learned that I'd rather not limp, and I'd rather try to walk as evenly as possible. So even though I was in pain, I learned how to do the actual movements. And what happened after the arthroscopic surgery was he could, this pain settled in there, and now I'm dealing with this foot thing that isn't going away. So I then went to somebody who deals with arthritis. I went to a rheumatologist. And as I mentioned to you, and this is important too, this guy was a drug addict. I'd walk in there and his eyes were bleary and he could barely talk. And this was that era. So I obviously wasn't interested in him. And then I went to a couple of other doctors, and I ended up with another surgeon. I think he was a neurosurgeon, I guess. And he had a fancy office overlooking the water. It was gorgeous. And he kind of looked at me. And again, it was I'm the authority, was his attitude. And he says, I think what you have in this thing in your ankle is a tarsal tunnel, which is the ankle version of a carpal tunnel. And I can operate. There's a 50-50 chance of success. And if worse comes to worse, I'll just cut the nerve. And I said, have a good day. I said, thank you. Have a nice day. And I never went back to another surgeon. It was just, now I've got to figure out how can I deal with this without having these idiots just cutting into me for their own benefit, because I didn't see any benefit to me. And so that was when I.
And that was still was that still in your 30s
Yes.
then?
Yes.
Okay.
Yeah.
Wow. So then moving forward, you were doing your yoga and managing, and when did finally things, get more intense, or what was the next step?
Well, the choice not to be operated on means what else is out there? Really, what else is out there? What else can I do? And so that began a journey of different types of homeopathic remedies and as I said, I settled on different ones that worked for a while, but nothing lasted. When I was, and then I reached a point where I was working for myself. I didn't have a lot of money. I didn't have any insurance for a good number of years. And when I finally hit Medicare age, when I hit retirement age, I got Medicare,
Mhm.
and I decided to hit the books and find out what I could do. And I had always had luck with my physical therapists. And so I decided to find a good physical therapist. And I did find one. He was very good. I really liked him, but he moved. And at the time I wasn't dealing with my foot. I had just sort of, my foot was in there, but I was beginning. And let me sort of preface this. When I hit my mid 60s, I really, because of the fact that I was always walking on this foot, I really had the sense that I had a limited number of steps left. Honestly, I really believed that there was going to come a day when I just couldn't go any further. And I was beginning to
Right.
notice it at
Wow.
night. And, at night I'd get up to go to the bathroom and I could, it was like I could barely hold my legs up. And I was getting these shooting pains in my legs. And they go, "Oh, it's neuropathy." But what the hell is neuropathy? So I'm getting these shooting pains. I'm getting afraid, and my fear, and I don't have a lot of money, so my fear is what's going to happen if I end up in the hospital. And so because I didn't have a lot of money, my whole focus was on staying as healthy as I could for as long as I could. And my yoga has been a major difference. So when I finally was able to, and by the time I hit my Medicare age, I was seriously worried about my ability to walk. I was afraid of ending up in a wheelchair. And I'm very independent, and this was not an option for me. And I had gone in to see this guy I had a trigger finger on my thumb, and I've had good success with them releasing trigger fingers. So without surgery. And I've never had surgery. So I went in and he started working. He then left that practice, and there were 4 other people in the practice, and I tried 3 of them. And I was fine with the guy that I was working with until one day. And one day I had walked in, and a lot of my pain in recent years has settled into my big toe. My the big toe on my right foot is like, it's the source of all electricity in the universe. And that's I could light up a small town with what comes through my toe. And I was seeing this guy. And I was nice and quiet. I had meditated before I walked in. I was laying nice and quiet on the table, and I had my eyes closed. And he walks in, and for whatever reason he chose, he grabbed my big toe and pulled it as hard as he could. And the lightning came through me. I didn't see it. I was it. It was me. It was just this white flash of lightning. And I sat up, and it's like, holy crap, what was that? And it took me a good 3 months for my toe and my foot to settle down from that. That's how sensitive my body is. And I've learned to be suspicious of a lot of practitioners who, no matter how well meaning they are, have harmed me. And so I thought really long and hard about what I was going to do next. There was one more practitioner left in that group. And it was like, all right, I'll give her a try. And it was that kind of a lovely serendipitous decision that brought me to MFR, because that woman was Cynthia Schnoes Gonzalez. And when I told her what had happened with the guy with the, pulling my toe, she said, "What I do is different. It's soft. It will not harm you. And it has a body, mind, and spirit effect." And being an old hippie, I love that whole concept because I appreciate how important that is. And she said, and we started talking. And as she started telling me about it, and she said, "Oh, and I also teach at the University of Miami, where I teach in the School of Physical Therapy." And I said, "Oh, do you know Carol Davis?" And because I had known Carol Davis, I had met her in the 90s before she met John Barnes, and we were friends. And I always loved talking to Carol. I loved the way she thought. We just blended so beautifully. And I always knew that Carol was an important person in my life, though at the time I didn't know why. And that's 30 years ago.
Wow.
And then suddenly in
That's
2020,
so
whatever
amazing.
that was, 2018, 2019, Cynthia's telling me I teach the same course that Carol Davis taught. and it's like life is a circle, and yes, you're in the right place. And it's interesting. Trust is an incredibly important thing for me, extremely important. And I've lost trust with many practitioners. So for me, it's like, okay, I've got to protect me because I know you mean well, but I can't let you hurt me. And so when she started talking, my trust started to open up. It's like if she's doing what Carol did, and she told me some stories, their relationship, and I thought, okay, fine, I'm okay, I'm buying into this. And I bought into and the body, mind, and spirit. And as I told you, I carry a lot of trash, a lot of garbage, a lot of luggage from childhood, as everybody does. And inside.
So let me interject here for Yeah, let me interject here for just a second. So, for those who are listening that may not know, just last week, the episode before this, I had Carol Davis, Dr. Carol Davis, on the show. So, she is also a John Barnes practitioner and a physical therapist. So, that was just kind of a neat little connection there. And this part that you're sharing, Janet, is so important for people, this whole trust thing. I agree with you. I feel like so many of the patients that I see have been told various things by all kinds of different providers, and it is hard to trust. And one of the first things that I say about the myofascial release that I do, and I try to get this in the conversation quickly because so many people have this preconceived idea like, oh, that must hurt. They expect it to be painful, and I let them know this is very gentle. It doesn't hurt. It never hurts because we don't force the tissue. So yeah, so I just wanted to throw that in there, but continue then about this whole trust aspect. So you met Cynthia, you started getting treated, and tell us about how that changed
Well,
your
and
outcome.
I started. I mean, I did my homework. I do my homework, and the more I learned about this,
Mhm.
it's like it was so multi-dimensional that it was kind of, how do you begin to grasp this? How do you begin to appreciate this? And and that's when I really got onto that MFR Insight page. Honestly, it was Cynthia had said, "Look, there are therapists,
Mhm.
there patients, there are people who know what's going on, and the people who want to ask questions." And I really resonated with that. But I'll start with the beginning on the trust with Cynthia, because again, I am a suspicious person. That's just how I am. And but what came up for me, and this is sort of my radical, okay, if this is really going to help me heal my body, my mind, and my spirit, I've got lots of junk to give to you, and I need to understand that you have the emotional maturity to handle it. Because if I'm going to have a breakdown, if I'm going to open up, if I'm going to release pain, if I'm going to release anger, if I'm going to release sadness, I want to know that you're going to be capable of handling that. And I didn't understand at first how, because I knew how much pain people must release in a session. How does a practitioner handle that kind of release? And so as she started to teach me about, setting boundaries and the importance of this therapeutic relationship, it started to come together. And as I mentioned, it took a good couple of sessions, um, and and the first couple of sessions were good and pleasant and soft, and I could feel some relief, with an F, relief. And I knew it was working. And I knew I wanted to keep coming back. And I was in my third or fourth session, and I actually started to do an unwinding. and didn't understand what it was, but it felt, it was like, okay, fine. But I was in this very awkward posture. My legs were kind of splayed open. It was not, it was not, and being modest, it was not what I wanted anybody else to see. And somebody knocked on the door. One of her aides knocked on the door and just opened the door without waiting. And it mortified me. And I actually had my eyes closed and I wouldn't even open them. It was like, I felt like, like when the animals are hiding and they close their eyes thinking you don't see them. That's what I did. And it was very bad. Again. It was not good. But I knew I had to deal with it. And this is where there's a certain level of courage you have to bring up in this. I mean, seriously, because when you're afraid, when you're in pain, when you don't trust, how do you throw that safety thing out and say, can I trust you? And so the very next session before we started, and this is what has started, and it's interesting. You hear how I'm talking right now. When I start to move into my deeper emotional levels, I stutter. And when I was really trying to deal with this incredibly important thing to say to Cynthia, it took me easily 20 minutes just to get the words out. And she was incredibly gentle and incredibly soft. And yet at the same time, she has a very nice inner strength. And so I was able, and I needed somebody and this was sort of like that, leaning on somebody to help me get through there. And so when I finally said, if this is going to work, if I'm really going to be able to let this shit out of me, and it's shit, I don't want it, that door has to stay closed and no one can come in. And that was when my healing began. Because from that moment on, we had an understanding as to what was important in my treatment. And then what started was a tumble, an outpouring of unwinding, of emotion, of pain, of old injury, of old memories, of old sadness. And the fear is always, it's never going to stop, so I don't want to cry. I have not cried with wet tears in years. I was crying. I was rolling off the table and going into a fetal position in almost every single session because I have so many. And that's why I believe I do have old birth injury, because my birth was so important in my healing. And it was I was in a very deep spiritual place. And I can tell you now, and it's interesting, it's been it's almost 6 years since I first started MFR. And I realize right now that I have been in a 5-year healing crisis. 5 years of healing crisis, where I just felt like I'm only going to go, I can get a little bit better, but I never felt like there was ever going to be an end to it. And the MFR has opened me up a little bit at a time. And that's been the most beautiful part about it, Cindy. I did, for the first year I worked with Cynthia, and then Carol was still in Miami and she was still working. And I thought, now that I know how Carol connects in my life, I want to have her treat me. And so I started treating with her. And then she told me about the immersions that she did with Craig Cohen and Tara Carrington. And it's like, I'm buying in, it's okay. And I did it. And it was a week-long healing clump of healing. I forgot how many hours a day it was. I think it was 4 sessions a day with all 3 of them. It was the most otherworldly, amazing thing. And I mean, very, very deep healing. I mean, and I felt it's funny. The imagery I had was that I was going down deep into this mine, like these. Have you ever seen these things of the kid that, that gets stuck in the mine and somebody has to go down and rescue him? And
Yes.
there's a very
Oh,
compelling, the internet, of course, Facebook, but there's a very compelling one in Brazil, I think it was. The tunnel was so narrow that an adult couldn't go down there to get him. And they had to take a 12-year-old boy. They tied a rope around his feet and lowered him into the tunnel to pick up the 3-year-old who had fell in. So you can imagine the fear. That was
wow.
the imagery, though, that I had of what was happening in my body, was that somehow we were going in and we were rescuing this little tiny baby who was locked behind this stuff. And there was seriously a moment when I was with Tara, there was a moment when I felt like I was inside a cave, and I had my eyes closed very tight, hiding. And at one point she said, "Open your eyes," and that's all she said. Open your eyes. And I could open one, and I literally had to kind of pry the other one open. They were closed so tightly. And when I did, it was like I felt like I was looking out of this cave, that I was this little teeny tiny being, and that this was my rescuer. This was it. This was the person that had the hand out saying, "Here, let me get you out of there." And it was an incredibly powerful moment. And this is what I've learned. I mean, I've learned so much, and that's why I love sharing it all, because I've learned so much from this, that we're always that little child. That little child never, never, never goes away. All it does is get covered over with more crap. And the MFR
Yeah.
helps us unwind all of that. That's that layering of the onion thing. And now that little child is me. It's not, and I know it. I feel her. This is the me I was before I started getting injured. The physical injuries have taken longer to resolve. And I know at this point that I'm always going to have some level of pain, but I now understand how to manage it. For me, and, like John talks about channel 5 and channel 3, like it's a radio dial. And for me, it's really like a faucet. It's like a faucet. And, channel 5 would be when the faucet is really tight, and maybe not, maybe there's a channel 6, but it's really tight and it's focused. And channel 3 is when you start opening it up and loosening it and allowing all of this stuff to pour out. So I don't know what else you want me to talk
Yeah,
about.
that's interesting.
Yeah.
Yeah, well, I let me just interject a little bit here for those who might not understand
Okay.
everything that you've mentioned. The channel 3 and channel 5, for example, John uses that, and he's been teaching this for over 50 years. And so, I've always thought of it as like looking at channels on a
Yeah.
television, right? Or you said radio, same thing, right? Like what are you dialed into, or what are you watching? You're watching channel 5, and channel 5 is thought of as our intellectual brain, our thinking side, our, where we have to live life. Like it's very important to have this intellectual kind of headspace that we are connected to. However, the channel 3 then would be more of connecting with our heart and our emotion, our intuition, and being in the present moment. So that's kind of how I explain it to people. And when we're in channel 5 all the time and trying to analyze and thinking, we're not able to be in this feeling space. And that's where what John says, where true healing happens, is in channel 3. And so, to get out of that intellect side and into that feeling intuitive side is where we can then open up some of these stored stuck things that are in not just the physical space. So when we talk about unwinding, um, a lot of people may not know that what unwinding is the body's ability to release this stuck emotion, or even positions of past trauma can come up, and the intuition and inner intelligence, inner wisdom of the body. when we allow ourselves to go deep into what we call channel 3 and really go into that feeling state, allowing the fascial system to express what it needs to be able to release that stuck stored energy, it may move. And you mentioned moving off of the table, which often happens with people who are able to go into this space, to get into a space of past injury where we may have, our energy body may have been shifted away from the physical body, and we need to kind of get that energy back into where it was at the time. And so having this still point perhaps in this space of trauma, and the therapist is helping and holding and supporting the patient at that point, then they're able to heal that position in space, so to speak. And that might be an emotional thing as well. So maybe it's not a physical position. I had a moment when I was a child. I fell off the monkey bars. I was showing my dad how I could hang upside down
Yeah.
with no hands.
Yeah.
And I had done it earlier that day. And of course, when I showed him, I landed on my face, and the next thing I remembered was I was in the ER, and I was ended up being fine, but it could have been bad, and of course there was all kinds of fear. Well, in one of my sessions, in an intensive, like your immersion, you mentioned, I had several hours of treatment for several days in a row, which is what they do at the John Barnes clinics, and we do it at Essential Therapies as well, and other clinics around the country doing John's work. We will do these intensives because sometimes you need more than just one session to be able to break that subconscious holding pattern, to help kind of that trust. Let's keep at this, keep going into this channel 3 space, taking up the slack or creating compression, whatever the system might need to be able to go into there. And anyway, I was starting to unwind off the table, and my body stopped in kind of this weird mid position, and I had a flash of a memory of falling off that monkey bar and landing on my face. And
Wow.
so I
Yeah.
healed that. I had no idea that was the thing. Now, at the time, I was struggling with severe migraine headaches. So was part of my headaches from that fall when I was 4 off the monkey bars? Probably. That intensive, and then some continued therapy after that resolved my migraines, which was amazing. But when we talk about unwinding, it can be a physical movement in space, or it could be a memory of emotional trauma where you're just even lying there, or abuse, or whatever it may be. So I love how earlier you mentioned that your abdomen was very tight and how you held a lot of emotion there. I do so much of visceral and abdominal work, and I see this all the time. And most people are unaware, when they have this tightness here and what they're
Right.
holding. And we have the solar plexus, which is very important for emotion, and the diaphragm. When people aren't breathing and there's this restriction, and they're breathing from the chest, then you can really feel this tightness throughout the abdomen. And there's so much healing that can take place just in parts of our body that we don't think of that are in pain. So it sounds like you experienced so much relief of that, which is
Yeah,
really
and
great.
my body is better. My posture is better. My walking is better. I had a crisis over the summer when I couldn't walk. Period. I couldn't. I was in so much. I have L5S1. I have herniated disc. I have a pressed nerve. I have things that are causing me lots of pain. And again, surgery wasn't an option. So sitting still gives you a lot of opportunity to observe and to see other things. And it was interesting because being in the hospital with all of the good care I ultimately got in my rehab, the one thing that was missing was the MFR. And I understand that I'm different, that people aren't necessarily going to go flying off the table the way I do. I appreciate that because but I also understand that it doesn't have to be that. I think it's even the mental decision. I'm letting it go. The mental decision that I'm going to let whatever's going to happen, and just see what it is. And maybe it'll startle me, maybe it'll worry me, but I know I've got company in the room to help me through it. So for me, I know a lot of people who are, like they go for one thing. I'm going to go get my arm fixed, and then they leave. And I don't think they realize the total holistic health healing that you get through MFR. I mean, I've really changed for the better, and I feel healthier. My my memory has gotten better, though there are times it totally abandons me. But things like that have gotten better, and I've lost
Yeah.
weight.
Yeah.
I was 40 pounds heavier, and I had to lose that because that was just killing me. I couldn't move. And so all of this was it was part of the whole plan, but it's been a major, major thing.
Yes, and you mentioned that people will come for one area of the body, for example. And of course, as John Barnes therapists, we're looking at the whole body and have our little fascia man picture. And I show that to people, and they can kind of see an example of the fascia being
Yeah.
restricted, how it pulls the entire body off. And John has this saying, find the symptom, look elsewhere for the cause. And goodness, I don't know how many times a week I say that to people, but it's so true, because where you have a pain, the true cause of that, or one of the main pieces of that puzzle, or layers of the onion, as you mentioned, could be at the head and neck, and we're connecting this whole area by feeling everything and not just looking at that particular joint or body part, which is what our medical system is set up with.
Yeah.
We have diagnoses codes and treatment codes, and that it's very myopic, looking very much at this pain, like at the pain in your
Yeah.
heel, for example. So you go to a doctor, and that's what they're, okay, you have ankle pain, okay, we're going to look at your ankle pain. And most people don't look beyond that, and we are highly trained to do just the opposite of that, to look at
Yeah.
everything and explore what else could be there. And you're right, not everyone will unwind off the table, right? In fact, the fewer people do that, than the whole, but it is definitely possible. And I think it's helpful for people to know that, wow, there's this other aspect to this work. And when we have these seminars, and John offers a myofascial healing seminar for patients and practitioners, which is really an interesting thing to go to, because as a patient, when you go there and you see people who've been doing this work for a while, and they trust, right? Let's go back to that trust word. They're trusting their own bodies, and they're trusting the process and trusting the therapist. Then they're able to go deeper into that emotional space, which may bring up emotion, and to feel free to be able to cry if sadness comes up, or yell if anger comes up. I mean, when I used to work just in the hospital setting, I mean, I couldn't count how many times, just out of the blue, a patient would start to tear up, and they would feel so awkward about it. And,
Yeah.
and they would apologize, instantly, before I could
Oh
even notice that
man,
that's what was happening. Like, I'm so sorry. I don't know why I'm crying. And then,
you want
I'm
them to cry.
would say, no, it's okay. It's good. And try to be able to explain. Yes, yes. And it's such a good thing to be able to release that. And that is a release, that emotional piece, to let that go. And like you said, how many times have we as children been, or even not allowed to
Right?
speak,
Oh,
right? like
totally,
like
totally.
first of all, there's the tears that come up, sadness, or you're a child, what you have to say doesn't matter, or how many times I had questions, and then those questions were like put aside. And there's so many layers to that. And yes, it's definitely a way to reach into some of that, which this work can do, which is so hard to explain, and impossible to
It's
research and
I mean,
document,
it took me a good 4 years just to figure it out, Cindy. Honestly, I read everything.
Mhm.
I watched
Yeah.
all of the what are they called? The biotensegrity parties. I watched all of these things, and I listened.
Yeah.
I couldn't understand three-quarters of the science, but I kept going. And that's kind of it. I mean, I kind of treat my healing the way some people treat climbing Mount Everest. It's no, but
Yeah.
in seriously, I think that it's that important because
Yeah.
I hate pain. I hate it, and I've learned how to make sure that it doesn't get in my way. I've learned how to surf it, to and I'm very proud of that. But part of that decision has to do with how I look at doctors and the medical community now. because I totally
Hmm.
respect their education, their experience, and what I've learned about the medical profession is it's extremely good at measuring things. They take all these tests, everything is testing, and they know how to do that. They're pretty good at diagnosing, and they're really bad at treating. And that's where the MFR comes in, the healing aspect of it. So even when I was in the hospital for 3 weeks, and it was a good hospital with good physical therapy, it was all structural therapy. And it wasn't until I was finally able to
Right.
see Cynthia 2 months after the beginning of my crisis that I really was able to get back to the deeper healing. And that's what I love about the MFR. It's brought my
Yeah. And
language back.
another thing
I've
I
lost my language in order to regain it.
wow. Yeah, that's neat. One of the things, I'll just go back to what you said about the medical profession and the ability to test, and that they're good at testing. That's great, but their diagnosing is only as good as their testing. And the problem is that fascia is invisible on all of their testing, right? So any MRI, X-ray, CT, they're not going to see that compressive force that the restricted biotensegrity of the fascia can do on a nerve or a blood vessel or an organ or anything in the body. So they're not aware of it, so they can't do any kind of treating for
And
that.
it's funny because my
So,
experience with MFR has allowed me to have something to measure what they're telling me against. So I know, and there are many times I
mhm.
know more than they do about how the body is working, and it's really been interesting. I spent a lot of my
Mhm.
time in the hospital educating them about MFR. I was very pleasantly surprised to find out that most of them had heard of not just MFR, but a good number of them had heard of John Barnes, and there was one person who had heard both of John and Carol. And so I know that it's
Great.
starting to get in there, but it was funny with all of the good
It
practitioners
is.
they had, it was MFR that was missing. MFR it's the thing that gets into your meltiness. It gets into the deeper part of you, and it's just it's amazing. I mean, I think I told you this, that even with your practitioner, I mean, when you're working with each other and you've been to, their hands are in your fascia and their fascia are joined with yours. You're like one being. You're like one other being. It's a different relationship. I mean, and
Indeed, there's a resonance. There's this resonance that occurs, and we are bioelectric beings, and so this is all
yeah,
part of that release for sure. Um, I am curious. I wanted to ask you this about what you do. And you're a mediator, and you have been for many years, and you teach mediation. And we talked a little bit about how this understanding of MFR and your understanding of mediation has kind of filtered together. And I think that was just really a beautiful explanation. And I'd love to give you the opportunity to share that with
thank you.
others.
I'm really happy to, because it was like a revelation. I mean, I've been a mediator for the bulk of my career, over 35 years, and mediation is the most civilized part of the legal system because it gives the parties the opportunity to negotiate their own settlement and make their own decision. No judge, no jury, and the mediator certainly doesn't make the decision for them. And in order to support their decision making, we have some very important guidelines and ethical precepts. And the basic thing for a mediation is to ensure the safety of the process. So it is a confidential process. The mediator has to be neutral and have no stake in the outcome, and the self-determination of the parties is primary, and it's, as you see, it's three legs. And what I started learning with the MFR and with learning about tensegrity and biotensegrity is that the way the body works, and the whole way that the discussion has been that it's not a machine, it doesn't work like levers, it's really this flowing integrated system that's working through pulling and tugging and all of that. I translated that because the legal system has the same problem right now. We misinterpret what the legal system is. We think of it as books. We think of it as these big these rules and these things that you have to follow, and that if you don't follow the rules, then you're in trouble. And I realized that we're really much more organic in how we work. Mediation gives people a chance to talk to each other. We are, as a mediator, I'm not naturally neutral. So I have to learn how to make sure I don't get in their way. So the confidentiality of the process is the equivalent of closing the door in the treatment room. And the neutrality of the mediator is the equivalent of this therapeutic boundary of the between the patient and the therapist, because the therapist, in the thing that makes mediation and MFR similar, is we want to invite our parties to be open and allow their emotional flow to come through. We don't want them to be rigid, we don't want them to be closed. And so I have to do something to soften them up in the same way you have to do something to soften your patients up. That's the goal, is to help them, kind of move back into their soft taffy like thing. And because when we're hard, either physically or emotionally, we're not open to to anything. I did this beautiful ropes course years
Yeah.
ago called the Challenge of Excellence. And their motto was, people are at their most excellent when they're having a good time, when they're having fun. And I thought, and it's true.
Yeah.
And it's funny because that became how I taught my course. I make sure it's fun. I make sure that they're, and I talk to them about, I teach them, I shared my lecture with you. I teach them about the body. I teach them that we're not this thing with the brain and the heart and the lung, and somehow we've got this mechanical lever that's working. I talk to them about tensegrity. And you know what? They get it. They get it. And they really love it because it opens them up to understanding why it's important to work together. Where we are as a world
Yeah.
is we're all closed up. We're all really tight in that even tighter level of channel 5, and we've lost the ability to have conversations with each other. So, what I teach my students is how to ask questions. What's important for you? Why is it important for you? What happens when you have it? What happens when you don't? How can I help you? So in a lot of ways, what I do as a mediator is sort of the intellectual equivalent of what you're doing with people, helping them untangle their restrictions. When people have a problem, they've got tangled up restrictions that are keeping them from doing something. And the only way I can get through to them is by talking to them, by asking them what's important, how are you doing? I was telling you, and it's very, and there's levels. I mean, and even this concept, and I mean, I totally resonate with how John teaches the course. And I did go to the healing seminar, and I had the good fortune to have him touch me 4 different times, and it was so lovely. But but what I love about how he teaches is that we need to find this place to slow down ourselves. That it's not about, okay, I've got the quick fix and it's done, because that's only a surface fix. We have to be patient. We have to be willing to slow ourselves down for our clients, so that we can hold them in that 5-minute hold. I can quiet them down. When I first start my sessions, and I was telling you, a lot. I know I've read a lot about practitioners, MFR practitioners, say, "How do I get my client out of channel 5?" And my simple explanation is, everybody walks in the door in channel 5 because we have to. You can't drive your car in channel 3. You can't be, and I prefer calling it
Right.
left brain and right brain because there is a flow. And if there's a 5 and a 3, there has to be a 4 and a 1 and a 2 if you're talking about a dial. So, so I'm looking at how do I quiet them out of their worries, because everybody walks into a mediation worried about what's going to happen. Am I going to be able to take care
Sure.
of my bills, my needs, my responsibilities? So they're already up there. So we start with a cup of coffee. We start with talking about the news. We talk about how was your weekend. We do schmoozing, which is a good, nice French word for it's Yiddish, but for just small talk. And there's a warming up time
Yeah.
that you need to help people move from this into, now how am I going to talk about something very serious, because I have to deal with people. Some of them are making the single most important decision in their lifetime in 3, 4, 5 hours. So I have to learn
Wow.
really quickly how to first of all get them to trust me, and I have to let them under, and I have to not just tell them it's confidential. I have to protect confidentiality. I don't have to just tell them I'm neutral. I have to protect my neutrality, and I have to encourage their decision making. So I want them to feel safe in my hands the way you want them safe in yours. So I will talk to them about everything. We're online now, so, and a lot of people usually come in looking like this, and it's kind of the talking head thing, and they kind of, and you see how it totally
Yeah.
loses some kind of credibility. So I will jokingly say, "Let me bring you into the 21st century, and I'll show them a good way to set themselves up." And I said, "Now, and because now you've got some authority and power," and everybody starts laughing. I can't share a cup of coffee. At least they can't smell it. I still have it, cafe con leche, by the way. Um, but I can find a way to connect with them as a human being. And that's what I want, because once we start talking about their situation, their worries are going to start coming up again. And my job is to help them do it one thing at a time. I'm not, they see the whole elephant. I'm going to start with okay, let's start with the left leg and let's work our way up. So my job is to kind of guide them through this very serious decision making in as gentle a way as I can, but there are times I have to push them. There are times I have to put some pressure on them. So I have a lot of the same things that you're doing in your physical world that I have to do metaphysically. And it's hard to teach. And the
Yeah.
interesting thing is, all of the analogies I use now have come from MFR. You see
Oh,
how I
that's
call
cool.
the body I describe as a combination of Gumby, the beings of light from the cocoon, Jello, right, and the
Yes.
Macy's Day
Yeah.
balloons. Because we are a little bit
Yeah.
of each of that. And so as we and what my students tell me is they use everything I teach them every single day. And that makes me feel good, because now I know I'm changing the conversation. Now I know I'm affecting how people talk to each other. And they're not going to war, they're understanding what went wrong. And that's a whole different thing. It's a lot harder. My partner used to say people are willing to spend billions of dollars on war and not a dime for peace. And it's true. But peace means
Yeah.
talking. Peace means talking about the difficult things that you don't want to talk about, the things that bring you pain, the things that upset you, the things that you are afraid to deal with. And that's kind of what your body is holding on to.
So, right. It reminds me of John tells us to become centered, right?
Mhm.
To be connected. And that's part of this whole channel
Yes.
3 idea. But it's also about connection. So we must have this connection with our patient, and how much better all of life is, I find, if we have connection also with ourselves to really part of what I teach with self-treatment, I use an acronym, CALM: connect, assess, listen, and move, because you have to connect. You have to connect even with yourself, and you have to connect with the patient and then with others. I love this analogy. It's super effective to see it that way. That the other thing that John talks about is, as therapists, we cannot be attached to that outcome. It's
Yeah.
it's like we're treating, we're connecting, we're being there, but we can't be attached to what
And that's
happens.
what
And I
neutrality
would
is.
imagine that would be
And
similar
that's
for
and
you as
it's
well.
funny because there one
Yeah,
of our rules says you can tell them what you know, but you can't force them to buy it. Don't buy into your own good advice.
right,
It's like, this is an option, but I'm not
right.
going to force it on you because I've got to stay out of it. I still have to protect your decision making. It's a hard balance. So yeah.
Well, it's really so. Just to kind of wrap up some of the things that you've shared, um, all of this pain you lived with for decades, really, and finding your journey, how it brought you to myofascial release, and that now it sounds like, yes, you still have a lot of these physical struggles and things, and where it's MFR is a journey. The healing is a journey, not an event, is another one of the things that John says
So
says
is
a lot, but
mediation.
you feel lighter. Yes. Yeah, isn't that interesting? So it sounds like you feel lighter, and a lot of these emotional things you carried and the abdominal, emotional stuff is softened, and we like to say released, and changed, and it continues to morph into different things. It's just really cool to see how you've brought this into your teaching as well. And as I just want to leave this open for you to, if there's anything you want to say, to wrap that up. But then also, it makes me wonder what advice you have for someone who may be listening, who's maybe heard of MFR, or maybe they even tried it a couple times, but they didn't really see any change because they just were kind of going there for, they were expecting like this big event, right? Just with your unique experience, what would you like to finish with and share?
Well, my advice to them is, oh, what the hell, try it. Um, what the hell?
Yeah.
But the reality is, I
Right.
could never have imagined that I would be in this place from where I was 6 years ago, when I felt my ceiling was like this, when I felt I wasn't going to be walking, when I felt like I was getting worse and I could feel depressed and all of that. That is gone. And as I said, everybody's going to do it at their level. And so it's the
Right.
first major step is deciding, I'm going to do it. I'm going to do it. Make that choice. And then love yourself enough that it's okay to let it be a messy kind of healing, that it's not going to be instant relief all the time. There are some things that are going to go away immediately. Other things take longer, but once they're gone, they are also completely gone. There is pain, but the pain comes up, and just as it seems to be bad, it goes away. Don't be afraid. I mean, as I said, this is the kind, and it's like I'm a nut for some of these stupid guys who climb up to the top of things and jump off. And it's that kind of, but it's
Right.
that version of it that we can do in our own lives. And for me, that's climbing up to the top and saying, I'm going to take the risk and do my healing. I'm going to start losing weight. And it's like, it's not, I'm going on a diet, because you're already on a damn diet, but you got to clean your diet up. So you start with making sure that you are paying attention to what you're eating. You pay attention to how you move. You don't have to be a rock star and pump iron and all that. You just have to move your body. And I like John teaches, and one of the things I loved in the healing seminars, he just says bounce. just bounce every day. And I translate to my students to dancing. My students sit in front of a TV, what do you mean, a computer all day long. And in the middle, I will make them get up and we move around and we dance because your body needs to remember it's supposed to move. And and it can and will heal itself. And I don't know that I always thought that was true. I've now understand it seriously is true. So if you're reluctant, I would say, and I'm happy. I mean, you're welcome to contact me, and I'm happy to support anybody because I think it's that important. It's true
Great.
healing. It is authentic healing. And as I said, I've done every kind of modality you can imagine. This is it. This is the winner on top of everything. So it's been fun.
I'm so happy you
Yeah, I
found
mean, I've
this.
enjoyed getting to know you, Cindy, and I one day I want to interview you and find out more about your life and everything because I'd love to hear about your horses and your ponds. And I saw all the deer outside your door. I mean, I love that.
Yeah. I'm very blessed to be in the country, but I wasn't always in the country, so it was definitely something that was later in life. I've only been out there about 12 years, but it's been great. So yeah, thanks for
Oh yeah,
mentioning that. And I will I want to mention for people who are all over in the country, there are therapists who are trained by John Barnes and gone to his seminars all over, and you can find that at mfrtherapist.com. Look up your state and do some searching. I can put that in the comments here. I'll also put in the comments links to the therapists that you saw who are still practicing there in Miami. For those who might be in Miami and want to look up some MFR in that area as well. And just thank you so much, Janet, for being so open and sharing and um, really so happy that you have gotten so much of your life back. It's very,
it's
very cool
been
thing to see. And that's our goal, is to let people know that this is possible, because so many people felt like you did, I'm sure, being worried about what's coming next, when medicine runs out of these answers and the pills and the surgeries don't work, there is another answer and another possible
and it's a
solution.
simple
It's the missing link, as John
and it's
would
a
say.
simple answer too.
Yeah.
It is. It's a lovely answer. No, I couldn't encourage people enough. I think that it's really important. And the other thing too is discovering that there's a group of people out there who are so brilliant. I mean, the tribe is an amazing group. I love the MFR Insight because I have met so many incredible people, including you, who are so brilliant and so motivated.
Yes.
And
Same.
it's given me the security to even become more open. So it's it's totally changed my life, and I don't know what else to say.
Beautiful. Thank
Thank
you,
you.
Janet. That's a great place to end. Thank you so much. And thank you for joining.